Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Apert syndrome is, its signs and symptoms, diagnosis and treatment, and how Apert syndrome relates to epilepsy. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to the Cleveland Clinic, Apert syndrome is a congenital disease characterized by craniofacial abnormalities and premature fusions of coronal joints, fingers, and toes. Apert syndrome is caused by genetic mutations in the fibroblast, growth factor receptor 2, FGFR2, a chromosome 10 gene responsible for bone development. Other medical conditions marked by skull malformations are linked to FGFR2 mutations and include Pfeiffer syndrome, Crozen's syndrome, Jackson-White syndrome, and Sathar-Chosin syndrome. The most apparent symptoms that, combined, differentiate Apert syndrome from other disorders. These include early closure of skull sutures, underdevelopment of central face area, and webbing of fingers and toes. Characteristics may cause an individual's head to appear elongated and prominently pointed, the forehead broader, eyes widely spaced and downward slanted, the nose flat, and their mouth left without a roof. These underdeveloped facial features can lead to vision problems, breathing difficulty, gastrointestinal issues, hearing loss, and a higher risk of heart disease. Craniosynostosis can cause increased pressure inside the skull, which can affect cognitive development, leading to intellectual impairment. Apert syndrome occurs in 1 of every 65,000 births, making it a rare condition. There are no preventative methods regarding Apert syndrome. Apert syndrome can be diagnosed in utero through genetic testing. Incidence is indifferent to sex, but there is a higher risk of inheriting the condition for individuals with a family history of diagnosis. Treatment options include early reconstructive surgical interventions to correct bone malformations or facial abnormalities, the use of adaptive technology such as breathing machines or hearing aids to alleviate complications brought on by respiratory, auditive, and other complications. Epilepsy can manifest itself in atypical presentations of Apert syndrome. According to the article, A Typical Presentation of a Newborn with Apert syndrome, researchers speculated that their patient's epileptic activity was triggered by a local pressure in the brain. However, in the article, A Pediatric Case of Transient Parietal MRI Abnormalities After Repeated Seizures, researchers suggested that epileptic seizures were triggered by an infection and a fever of a 1-year-old patient. Research suggests that conditions that are caused by FGFR mutations are associated with a greater risk of having learning and intellectual difficulties. Studies have shown an increased rate of epilepsy in adults with Apert syndrome. In conclusion, Apert syndrome is a rare autosomal dominant disorder caused by a genetic defect. The condition is marked by craniofacial malformations and webbed digits, although abnormal presentations can include epilepsy and cognitive development difficulties. Among other theories, the occurrence of epileptic seizures in individuals with Apert syndrome hints at a potential relationship between epileptic form brain activity and cranial pressure triggered by Craniosynostosis. Symptoms can be diminished with the help of corrective surgery and/or targeted therapy, although it is recommended to contact your child's healthcare provider to determine which treatment is right for them. To learn more about Apert syndrome and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.